Good morning. This morning I'm going to talk about another drug shortage. It just seems that the stimulant shortage seems to be easing nationwide, but now we're faced with another drug shortage. And this time it's with antibiotics used in childhood infections. Namely, we're talking about amoxicillin and augmentin. Augmentin basically is just simply another form of amoxicillin. It has two ingredients, amoxicillin plus chloronic acid. And augmentin is often used when amoxicillin failed to treat an infection because the bacteria causing the infection has developed resistance to the antibiotics that's being used. So why are we facing these shortages again? Well, let me remind you first of all that we faced a tremendous amount of shortage in the beginning of the pandemic in 2020. Remember, there was a time where we couldn't get any toilet paper. Remember, there was a time we couldn't get any food. We had a hard time getting even the basics like milk and eggs. That was partly due to a surge in demand because people's perception that there's going to be a shortage, which drove up people's urge to stockpile on these supplies. This time, the shortage in antibiotics is once again driven up by increased demand. And you can say, similar to the toilet paper, it's increased by demand based on people's perception. There's definitely a realistic demand and usage of these antibiotics. And this is occurring because, as I mentioned in a video previously, there's an increase in the number of children suffering from RSV, or respiratory syncytial virus. And little beknownst to the general public, up to 50% of children under the age of 6 who recover from RSV may end up with a bacterial ear infection. This is common knowledge among pediatricians, but parents are often surprised to hear that. 50%, that's a big number. 1 in 2 will suffer from ear infection. And of course, the most common treatment for ear infection is amoxicillin, and in some cases, augmentin. But I suspect this shortage is stimulated much more by simply the number of children being diagnosed with ear infections. I suspect that to some degree, the parents are also demanding antibiotic treatment because when they see their children just suffering one cold after another, barely recover from RSV, now they have influenza, which is the main agent that's circulating around. And COVID certainly is making a comeback too. So ever since children starting school this year, they have been just inundated with infections, one after another, most of them viral. But as I mentioned before, RSV often trigger ear infections. So now there is an increased demand for for amoxicillin in the treatment of ear infection. But also, some parents may pressure their doctor to prescribe antibiotics simply because they just need to do something. And instead of spending the time to explain to the parents that antibiotics do not work against viral illnesses, they only work for bacterial infections such as ear infection or pneumonia. It's much easier for some doctor to give in to the pressure and simply, choose the easy route to prescribe the antibiotics instead for something that may not need antibiotic treatment. I can imagine the temptation to yield into such pressure because we are seeing 6 to 7 times more patients compared to a typical winter right now. These are people just walking to urgent care, walking to the emergency room, In fact, our hospital has already set up a triage area for overflowing patients. I think the average wait in our emergency room is 12 to 18 hours. Hours. That's pretty insane. Anyway, we survived pandemic for almost 3 years now. I'm pretty sure we can survive this. It's not going to be easy, but at least we have toilet paper. So what can you do about the shortage? Well, you don't have to worry the logistics, because usually the doctor will prescribe an alternate antibiotics that also works equally well for ear infections. In this case, the most commonly substituted is ceftonir, which is a group of antibiotics called cephalosporins, or it could be another medicine called azithromycin, which is a group of antibiotics called macrolide. These are often antibiotics that we select to prescribe when the patient is allergic to amoxicillin or penicillin. So these are also commonly available, but they're not nearly as oftenly used as amoxicillin. They should work just as well, and you should rest assured that the infection should recover from the antibiotic treatment. If symptoms do not improve after 2 days of using antibiotics for ear infection, definitely reach out to your pediatrician. Perhaps the bacteria that's causing the infection has become resistant to the antibiotics that's being used. All right, I hope that's helpful and elucidate the reason why the antibiotic shortage is occurring right now. All right. Take care. Bye-bye.